Good afternoon, and welcome to the Council on Aging's first meeting of 2009. Today we have a very exciting program, and I think it's an example of the type of information, the type of product we bring to you each and every month. Today we have a gathering of service providers who can answer dozens of questions and give us a really strong idea of some of the services that are available in the Conejo Valley in Thousand Oaks. We would encourage you, if you are watching this program and you hear things that are to your advantage, that'll make your life better, that'll make your life safer, that'll make your life healthier, tell a friend. We come every month to bring you all we can in terms of information, up-to-date information on things that are going on, scams that are happening, housing problems, transportation problems, new issues on health, legislation. So this is your program, and we encourage you to encourage your friends to join us. So this meeting of the Thousand Oaks Council on Aging is called to order. And Nick, if you would, please lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Francine, could you call the roll, please?
Commissioner Borghi?
Here.
Commissioner Fotheringham?
Here.
Commissioner Grimm?
Present.
Commissioner Loomis?
Here.
Commissioner Norkin?
Here.
Commissioner Poprock?
Here.
Commissioner Shentes?
Yeah.
Commissioner Sturden?
Here.
Commissioner Silverberg is not here yet. Thank you.
Now is the time for public comments. Our first speaker is Susan Cashman. Susan, if you could go to the podium.
Thank you very much for having me here, ladies and gentlemen. I am Miss Senior California 2007, and I want to tell you, about 37 years ago, a young doctor was working a crisis hotline in Atlantic City, and he became very, very unhappy because he noticed that most of his calls were coming in not just from women, but from older women. They were very depressed, they were lonely, their families didn't have time for them, they were too busy. And he said, this is wrong. He said, seniors are our national treasure. They're the backbone of our society. We've got to do something about this. And that's when the first Miss Senior America pageant was born. One state was all that participated. But today, there are 40 states that participate in the Miss Senior America pageant. California came aboard in 1986, I believe it was. 1986. And we are the largest state. Most states just have one pageant. And why do they do this? First of all, it allows women who have reached the age of elegance to step into the spotlight of grace and dignity and accept the recognition they so richly deserve. They are judged in 4 different ways: by their modeling and their evening apparel, their philosophy of life, their talent is very important, and the private interview. The private interview is the only thing the audience doesn't get to see. Today, the state of California has 7 preliminary pageants, and I'm very happy to say that this is the first time there is going to be a venue here in the beautiful Conejo Valley. In May, we will have our first annual Miss Senior Conejo Valley pageant. It is open to women 60 years of age who are citizens of the United States. The only criteria is that you do need to have some kind of talent. Now, talent can be anything, not just singing, dancing, musical instruments. It can be reciting poetry. The lady who won first runner-up when I was in the Miss Senior America pageant read a poem of taps, the story of taps. And it was so overpowering that she became the first runner-up to Miss Senior America. She was that good. So a talent can be anything. But I hope that you will spread the word, help me spread the word. We are a nonprofit organization. We cannot afford advertising, and it's mostly by word of mouth. But I'll tell you, I will guarantee you, ladies who join this, you will have two things. Number one, you will meet some wonderful women, and number two, you will have a wonderful time. It's a lot of fun. So I encourage you, and if you can, if there's a way of calling, my name is Susan Cashman. Am I allowed to give my telephone number? My number is area code 818-883-8975. And please spread the word. There's got to be a lot of talented, wonderful women out there, and we'd love to meet you. Thank you very much.
Thank you, Susan. Are there any other public comments? All right, then, we'll move on to our guest speakers, and I will turn the program over at this time to Commissioner Harry Norkin, who is our chair of the Programs Committee. Harry?
Thank you, Jim. You almost avoided me giving an introduction, but I'll carry on. Good afternoon again, and welcome to our featured section of today's program. We have invited 5 people who are knowledgeable and active in the area of senior living. I'm going to call out, name the speakers, maybe not in the order they will speak, but I'm going to name all 5 of the speakers. And the order I call them is not necessarily the order they will speak. First on the list is Carol Freeman, President of the Senior Concerns, who will speak on the program for seniors sponsored by Senior Concerns. Next will be Maureen Simons, the Director of Senior Concerns, who will tell us about the benefits of the Adult Daycare Center on Hodenkamp, which is also run by Senior Concerns. Next will be Dylan Howell, owner of Select Home Care, who will be speaking on care services provided in the home for seniors who wish to remain in their own home. Marianne Knight, owner of California Senior Living, will discuss senior care facilities in our area, and Kimberly Jackson of Vistas Hospice will talk about Vistas Hospice service to terminal patients and its benefits. And with that, I'll turn it over to our first speaker, which will be, I guess, Carol Freeman, right?
Good afternoon. You know, Susan, I don't know if any women took your phone number down, but I bet a lot of men did. I am Carol Freeman. I'm president of Senior Concerns, resident of the City of Thousand Oaks for many years, more than I want to admit, perhaps. Thank you for the opportunity to be here today. I'm going to add an extra thank you for those on the city, for those of you on the Council on Aging. This body of people in 1975 were part of the founding members of Senior Concerns. So some of the folks, the impetus for what we are today started with a group like you guys, private citizens, grassroots, seeing a need and starting an organization like we are today. So I'm going to say thanks to your heritage also for bringing us where we are today. Senior Concerns' mission is to provide services to frail and special needs seniors, their caregivers, families. It might be any kind of program that you'll hear about here today. It's also just public education, outreach, and many of you know the programs that we do over at the Global Center. Our vision is that we can be the resource. If you have a question about a senior or you are a senior, we're the place you call. Some things to ponder. Maybe they pondered these things a little less likely in 1975, but here's some things to think about and why we exist. Poor nutrition leads to illness. One day stay in a hospital could pay for an entire year's worth of Meals on Wheels to an isolated senior who can't or doesn't cook for themselves. Alzheimer's disease is a very unwelcome stranger and not one you can get rid of. About a third of American families, and certainly here in the Conejo Valley, about a third of the folks are taking care of their aging senior parents in some way. And that consumes, it's estimated, around 100 hours a week. Now, I happen to have met most of you folks over the last year or so, and I know you don't have another spare 100 hours a week to take care of somebody. Caring for aging loved ones is frequently a burden, and that's where we come in again. We also are a nonprofit social organization. which meets the needs of, it's estimated that somewhere between 6 and 10% of the seniors living in the Conejo Valley in the city of Thousand Oaks live at or below the poverty line. And to add to that problem, by 2030, there'll be double the number there are now. This journey we call life isn't always easy, and so that's why Senior Concerns does exist. I'm going to run through just a few of our programs, so those of you watching and the folks sitting behind that panel and those here in the audience will get a sense of the wide breadth of things that we can do for seniors and their families. Meals on Wheels, first program, 5 meals delivered on June 16, 1976. Today we deliver around 100 of them a day to seniors in Thousand Oaks who, like I say, either don't or can't cook for themselves. In addition to the meals we deliver every day of the year except for Christmas. And in addition to those meals, some seniors are perfectly able to cook for themselves and would like to cook for themselves, but may again be in a low economic, and their brown bag program that we coordinate with Food Share, and we deliver brown bags full of groceries to seniors who need that assistance. Adult Day program, I'm not going to talk a whole lot about other than to say what it is. It's because Maureen is going to follow me and she'll kick me if I start taking on her words. But day program is just that. It's an active day program for the frail and perhaps those with memory loss, Parkinson's, post-stroke. I'm 102 and I need a place to go every day, but I don't have the strength to go to the Global Active Senior Center. So we have programs that take care of the frail elderly in there. About 45 or 50 folks a day, every day, and a couple Saturdays a month. The program that probably reaches the most people out there and can answer your question on a phone call is our Senior Advocacy Services. Those are the services of the people we call the senior advocates. Tony Hagopian over at the Global. Drop in any day if you're at the Global and find Tony, and she can give you assistance on whatever you might need. Betty Berry is also known as a senior advocate and is on our staff. Betty is most often known as the lady that writes that column. And if you've been looking for her column, it's no longer on Mondays. It is now on Wednesdays in the Star. So it's still there. You just got to look on Wednesday instead of Monday. The kinds of things they address, along with 2 of our case managers. And case managers tend to do a more in-depth problem-solving and planning process than maybe Tony or Betty might do for you. Betty and Tony frequently refer into the case managers. The case managers is funded, again, from a grant from a Ventura County Area Agency on Aging, along with our own fundraising efforts, but it's funded from there. They can go in-home visits to do a home assessment. They can meet with families. They also are staffed at the Simi Valley Active Senior Center. So if you're watching this and know somebody in Simi Valley, they are over there. They are also at the Florence Jans Senior Living Housing here in Thousand Oaks, and the Latoya Terrace over in Moore Park. So our wings are spread a little beyond Thousand Oaks, though most of our work is here. They will answer questions, all of these folks answer questions on such things as Social Security, housing, health care benefits, Medicare Part D. We're kind of glad December 31st arrived and you all had to make your decisions on that. Health insurance. Sometimes they're very serious issues for, I've been evicted, I don't have a place to live, my husband just died, I don't know what I should do. Questions range everything from where's the Social Security office and what's their phone number to I've been evicted and have no place to live. So don't hesitate to call. They are your answer people if you're a senior or if you're a family member needing resources or wanting to know where to go about a senior. I want to mention also our public education series. Betty Berry goes around the county, really, doing programs for and about seniors. Everything from will you pass your next driving test to caring for your aging loved ones to, again, those things that I've mentioned before. We do a public education series. The next one is in February, and that one is going to be on housing for seniors. So issues of if you've decided you're going to downsize and you don't know how to approach emptying out that 5-bedroom house down to a 2-bedroom apartment, we'll give you some answers there. If you don't know where to turn to look for the kinds of housing you might want, that's the kind of panel that will be there. So that's in February, I didn't write the date, 12th, I believe, but check with Senior Concerns or look on our website. We reach about 2,000 people a year on our public education series. So do pay attention, look on our website, watch for it in Betty's column, watch for it in the Star. Our last program that I'm going to mention really doesn't get much publicity, but has been filling a very critical need, and that is something called FAST, Financial Abuse Specialist Team. We coordinate that team for the entire county of Ventura, and it's a group of 45 professionals that might be involved in that issue of financial abuse to seniors. It's Public Defender's Office, it's the District Attorney's Office, it's Adult Protective Services, banking, legal profession. And they meet once a month and they discuss the issue. They've provided a DVD and some educational brochures. They will come out and speak. If you have a group or an organization that you'd like to have them speak to. They also compare case study notes without getting into confidentiality or privacy, and look to see if it's being handled the best way. And their effort is to make sure that if law enforcement becomes involved, it's effectively handled, prosecuted, dropped, whatever needs to be. But FAST is one of our newer programs. We couldn't do any of this without our fundraising because I said before, we are a nonprofit organization. Yes, we do charge some fees for programs, but it's always based on the ability to pay. No one is turned away if they need one of our services. Our bargain boutique, people from millionaires to the very poor shop at our bargain boutique, and you'll find it's quite a delightful place over there in the Under One Roof building on Hillcrest Road. And if you haven't been there, you've been depriving yourself of a real treasure. A couple other fundraisers I'm going to mention. First Sunday of June is our Love Run. Around 900 people run for no good reason that I can see, but they do run. And they enjoy it. I watch them and cheer them on. But the first Sunday of June over by the Hyatt Hotel, and that's a fundraiser. And then the one I particularly enjoy is our Ultimate Dining Experience, first Sunday of August. Again, it's hosted by the Hyatt. They've been a wonderful partner to us, and it's a major portion of our annual revenues that it takes to do the services for those who are in most need. So I thank you for your time. I'll be around if you have questions after everybody. Oh, sure, Jane.
One quick one.
Yeah.
Has the current economic crisis increased your workload?
It may be just a little too early for us to tell. However, we were just looking at some numbers yesterday, and if I look at our day program specifically, the day program this time last year, new people entering the program was somewhere around, I believe it was 23. We start our year in July, so in the first 6 months we had like 23 new people, and this year we've had 48. Is that a result of economic, because they can't, of what's going on, or is it something else? I can't tell you that. What I will say is our bargain boutique is much busier now than it used to be, and was particularly busy over the holiday time. We really have high-end products in there, very gently used things, and we had a much heavier load, if you will, but much greater revenues for us in the month of December in our bargain boutique. Yeah, Mel.
Thank you, Carol. I just wanted to mention Carol is also a member of our Senior Advisory Master Plan. My question is, have you had any impact yet on the county within the state budget?
The question is, I think maybe I'm getting signals that maybe your mic wasn't on, Mel, but I'll repeat it for you so they know out there. The question was whether or not the budget issues have caused us any concern if we made any headway. We received, in those funds that we received from the state, now, from the state we receive grants. We don't receive other funding from the state. We can't bill for service, such as a Medi-Cal or a program like that. So it's strictly a grant. One of our grants was reduced by 10%. Our Meals on Wheels, we have had some decrease in funding, but we have not had a great decrease other than the 10% was a pretty significant hit. That was around $8,000. So that was a significant hit to us that we need to make up in another way. We have not made, to answer the other part of the question, any headway in stopping that altering that. And Maureen may be able to speak to the day program specifically regarding that.
Thank you.
Any others? I don't want to rush. Thank you.
Thank you, Carolyn. Gary?
Thank you. Our next speaker, Maureen. Yes.
Good afternoon. My name's Maureen Simons, and I've been the Director of Programs at Senior Concerns since 2002. In my first life, I was a midwife, so I've gone from one to the other eight. Both equally gratifying. I'm here to talk about the Adult Day Program. I've been with Senior Concerns since 1997, so I have quite a bit of experience with day programs. And I'm also on the board of the California Association for Adult Day Services, so I know about the angst that the cuts in the budget have made, not just to our program, but specifically to adult day health programs. An adult day program is a planned activities designed to promote well-being through social and health-related services. Adult day centers operate during daytime hours. We're not a 24-hour facility. Senior Concerns is open from Monday to Friday, 7:30 till 5:30, and 2 Saturdays a month from 11 till 4. We found that caregivers who worked all week and had their family members at the center from 5:30 till 7:30, or 7:30 till 5:30, didn't get a break on the weekend. So they love that 4 or 5 hours on a Saturday afternoon to go off and do their shopping by themselves. The intent of the day program is to provide older adults an opportunity to get out of the house and receive both mental and social stimulation, and to give caregivers a much-needed break so that they can attend to their personal needs, or simply sit down and relax and read a book without somebody asking a question every minute. Senior Concerns program was started in 1978 in the little house on Flitner, which Habitat for Humanity took over, and somebody's living there now. So we've been in the facility on Houghton Camp since 1993, I think, and we expanded it and doubled the size in 2003. So we've gone from 10 to 15 people a day up to 55, but we average about 45 participants a day. It's very challenging to admit that you need help when you've been a primary caregiver all your life, taking care of a family member, whether it's a spouse or whether it's a parent. And I think I make it easier for people to come into the program and say, yeah, I can do this. Who wants to leave their mother, husband, father, anybody with a bunch of strangers? And I invite you to come in and find we're a great bunch of strangers. Any service, the best time to start exploring when you need it, obviously, is before you need it. But nobody ever does that. We're all looking. They end up at my center in a crisis. What am I going to do? Where am I going to go? So you base this on people who can no longer structure their daily activities. They need supervision the whole day. They're isolated and they're looking for someone to talk to, and they can't be left at home anymore. They get into mischief when they're left at home, leaving stoves on and such like. And the person they live with works outside the home and really needs somebody to do the supervision. It's hard to find the right center, but Thousand Oaks, we're extremely lucky. We have a wonderful facility that the city helped us with. Caregivers come in and feel at home when they come into the building. They come in and immediately feel at home. But the best thing about the day program, the best thing about the center is that we are able to offer programs for different abilities. The centre is designed so that we have a program for people who have minimal losses, who just need the support of staff during the day. We have another program for people who need a little more help during the day, need somebody to start the conversation. And then we have a program for people who have severe loss, who really could not be left at home, and in any other circumstances would be in a skilled nursing facility. So the Fund Seekers is the program for people who have minimal losses. Some of them have Parkinson's disease, some of them have stroke-related issues or are in wheelchairs, and they have activities that range from yoga to field trips, and we have people from the community come in. The district attorney came in and he did talk to them about scams and how to be aware when somebody calls. Not that any of our participants, well, many of them, there's 3 or 4 that live by themselves, but to get that telephone call and not respond to it because it's a scam. We have our own bus, so this group of seniors go out on field trips. Some of them have been here to listen to wonderful classical music during the day. They've been over to the Goebel Centre to listen to big band music. They've been over to the Caludran University for their art exhibitions and wonderful photography. So we have very interesting activities for them. The Fitzgerald program is, because the centre was called, if you all remember, the Fitzgerald House, and a lot of people in the community still call it the Fitzgerald House. So we've kept that name for one of the programs, and that's the one for people who have mild losses but need the interaction of the staff during the day to engage in conversation. Some of them have lost the ability to start a conversation. They can carry on a conversation, and we'll keep it going if you start it, but have lost that ability. We have a wonderful art class in that program, and we have a knitting and sewing group, and the seniors have made beautiful quilts that are hanging in the building for people to see. We have discussion groups, and some of the people have a little bit of Alzheimer's. Some of them have, just a little bit of memory loss. And so to listen to them and ask them questions, and I'm sitting in my office going, wow, I didn't know that. And an 84-year-old who really can't remember very much during the day will answer questions just like that. And we have bingo. I tried to take bingo away.
And you lived to tell about it.
I did live to tell about it. I had a group in my office to tell me why I shouldn't take bingo away. So we still have bingo. And they win for chocolate. So it's a big incentive to win bingo. Our friendship program offers the highest level of care. All of our participants have moderate to severe dementia and depend on others for everything, all activities of daily living. But that doesn't mean that's all they do, feeding, eating, all that kind of stuff. They have activities exactly the same as the others. It's just geared to them. We play a lot of music in that program, and music is amazing because people who don't normally talk, are really non-verbal, will sing. Remember all the words to songs from the 20s, and you just sit there and go, wow, I didn't know that. And the ratio in that program of staff to participants is 1:3, so there's a lot of hands-on. To enroll in our program means a visit with me at the centre. So I invite people to come in, have lunch with us, and have a tour of the centre. And then there's an interview process where I make an assessment of the level of need, which program they should be in, because sometimes the caregiver's idea of level of care is not always mine. And I love it when they come, and people think, well, it's a sad place. Well, it's not a sad place. If you could hear the laughter that goes on at the drop of a hat at Senior Concerns. I would like to say in conclusion that the goal of our program is to keep families intact and prevent premature placement in long-term care facilities. We provide a safe, secure, nurturing environment in which to spend the day. Socialization and peer support are amazing. Friends are made. At 80, you can make a friend. At 90, you can make a friend. So, it's never-ending friendships. We also see improvement in both mental and physical health of both the participants and the caregiver because of the stimulation. We offer nutritious meals and snacks. It's like being on an aeroplane, you know, you go from one meal snack to another, keeps you going all day. We see improvement in an enhanced level of independence with our seniors, and certainly with the caregivers. There is a charge for the program, but no one is ever turned away for the lack of ability to pay. We are the only Alzheimer's Daycare Resource Center in Ventura County, and we do get a grant from the state of California for that through the Area Agency on Aging in Ventura. Thank you. Any questions?
Maureen, thank you. Do you, right now you have like 55 people a day there, and what capacity, how high can you, what is the capacity of the facility?
On our license it says 75.
75.
And I think that, but there's a caveat that because that when they designed the place, when it was built, needs have changed. So it was, if you looked at it, 75 people 20 years ago, that was, 15 years ago, they would have fitted in. But now we have more impairment. There are more people with wheelchairs and walkers, which take up more space, and more staff. So I think if we had 60 to 65, we would be tight, squished in there.
If you had to crystal ball 10 years, 15 years hence, what might that number be?
Double what we have now.
Thank you.
Welcome. Anyone else? Thank you.
Thank you. Our next speaker is Dylan Howell. Thank you.
It's great to be here this afternoon. We live in a beautiful place here in the Conejo Valley, and we live here because we want to, and we enjoy it, and we like it. And I'm going to share, for a few minutes, talk with you about home care, what home care is, more about home care, who needs home care, who wants home care. So bear with me as I do so. Home care can be referred to in many different terms. I'm going to be speaking to you about the non-medical aspect of home care. Personal care, it could be called companion care, custodial care, caregiver service, but for today I'm going to refer to it as home care. Our clients are primarily older adults or impaired individuals who may have impairments cognitively, physically, emotionally, and need some type of care to remain safe and comfortable inside their private setting of their home or residence place of where they are living. Our staff comprise of caregivers. These are professional caregivers who have been managed and trained by our company to provide in-home care. They could be nurses, aides, they could be certified home health aides, or caregivers by profession. The scope of care that we provide that contains home care is the activities of daily living, which really is a broad array of services, but to break it down simply, first and foremost is personal care, helping clients with as much or as little that they may require. For example, it could be personal hygiene, bathing, showering, dressing, grooming, and assistance with mobility. It could be mobility supervision, transferring assistance, helping with self-help devices such as walkers, wheelchairs, lifts of various forms. We also will help with transportation. transporting clients, whether it is driving with clients in their own vehicles, driving clients' vehicles with them inside the vehicle, or running errands, shopping, groceries, picking up things from here or there. We also will help with medication reminders. Because we are a non-medical service, we do not perform clinical treatment. Nothing invasive is performed by our staff. However, we will do medication reminders to be sure that clients are taking the appropriate doses and medications as prescribed by their doctor. So how do we find care is a good question. And not only how do we find care, but how do we find quality care? So I've listed a few questions that I would invite listeners to ask potential service providers. How long have you been in business? Or how long have you been a caregiver? Are you available 24/7? Who pays the payroll taxes? Ask for references. Who manages the care being provided? Who provides caregiver training? And also ask for license and certificates of insurance policies are always helpful when finding in-home care. There's two versions or models I should introduce you to when it comes to in-home care. One is a full-service home care company, and the other is often referred to as a private caregiver or a domestic referral agency. And these are two very different models, but yet provide the same level and same type of service. And I share these with you because the state of California is trying to make some drastic moves to provide more regulations when it comes to home care. First is full employment home care service. This is when a client pays the home care company directly. And the home care company will then manage, train, schedule, staff, and cover all the liability of that in-home care provider. The other method, as I mentioned, is independently or a domestic referral agency. In this situation, the client pays the caregiver directly or will pay the domestic referral agency directly. In turn, this client receives or assumes all liability when it comes from payroll taxes, workers' compensation insurance, liability insurance, bonding, and the list can go on. Again, the two different models that the consumer should be aware of when considering in-home care. The next thing I'll talk to you briefly about is who pays for this care. This service is considered privately funded. Medi-Cal, Medicare, Medicaid does not fund in-home care. So the consumers, the clients, are left to pay for this bill. Long-term care insurance, if the policy has home care written in it, it will be covered. It's all dependent upon the policy of how much the maximums are allotted for home care. Workers' compensation insurance can pay for this if it's a work-related injury. And the last one is the Veterans Aid and Attendance Program, which can fund a portion of the service based on some criteria that you have to meet. The rates of how this service is based is, and I'm speaking very broadly, is it can start at $18 an hour and it can go up to $26 an hour. And it's dependent typically upon the level of service or the care that's going to be provided to the individual client. How do you begin care? I talked briefly about some of the questions to ask, but I didn't mention, where do you typically go to get a referral of a reputable service or company? We had two speakers prior to me who I invite listeners to contact. Senior Concerns, the senior advocates are great proponents and educators to this community of where to go to find referrals for in-home care. The process typically is that an administrator or an operator or a nurse would come to the home and evaluate and speak with the family, the client, about what their needs are. Again, non-medical needs of what they may need, what they may require when it comes to in-home care. and then a plan of care is put in place. It could be as little as a couple hours a day, and it could be as much as 24 hours, 7 days a week. But it's very important that a plan of care is put in place so that the client, the family, is able to rest assured knowing that there is a professional service that's able to meet the needs of this individual client. If there's no other questions, then I will introduce the next speaker, which is Marianne Knight with California Senior Living. Thank you. Is there questions? All right.
The fee that you mentioned, the 18 to 26, that covers then all of the workman's comp, all that stuff?
Yes, it does. It varies company to company. I'm trying to give you a pretty wide range.
Specifically your company.
But yeah, with my company and most competitors that I could speak for, 18 to 26 is a pretty wide range of what the services would cost for the full employment home care service, which does, again, cover workers' comp, payroll taxes, all the fees being encompassed by the company.
Okay, thanks.
I'm sorry, question?
I have, I'd like to ask a question. Are you listed in the Council on Aging Directory of Seniors of Services for Seniors? We publish one every 2 years or so, and I don't recall seeing your company.
I don't know, to tell you the truth.
No.
I don't think so.
Okay.
I don't think so.
Then we'll contact you about getting...
it sounds like we should be in there.
Yeah, you should be in there.
Yeah.
The kind of folks you have doing the in-home support, are they, if not degreed, or do they carry some certification?
It varies. Our company has a minimum standard that our staff must meet in order for us to hire them. They can be certified by the state to be a certified nurse's assistant or a certified home health aide. Those are the only certifications that the state would have on them. Home care in general, there's no licensing required, which is kind of a terrible thing when you think of there's no regulations that the state is putting on us. So therefore, we put in some standards and procedures in place so that we can meet those. But in regards to your direct question, unless they're a certified nurse's assistant or a certified home health aide, no.
Okay. Thank you. Our next speaker will be...
Marianne Knight.
Thank you. Thank you again for having us today. I'm Marianne Knight, and together my husband and I own California Senior Living, a free referral service located here in the Conejo Valley, and we are residents of Thousand Oaks as well. My job today is to speak with you about the different types of care facilities that are located in our community. First, we have the independent care facilities or independent living facilities for seniors. These are hotel-like communities that provide what we call the basic services. Residents generally have their own private apartment. For a monthly fee, they receive 3 meals a day, housekeeping services, activities, transportation. No care is provided in these types of facilities by that facility. More commonly in our community is the assisted living community. Assisted living communities are also a large hotel-like facilities. They provide all of those basic services along with care facilities provided right in the privacy of the resident's own apartment. This would be non-medical or custodial care. Examples of this would be assistance with bathing, dressing, medication assistance, help to and from the dining room, maybe assistance with helpful reminders. Non-medical, non-nursing care, but assisted living. Under the assisted living umbrella of services is the board and care facilities. Small board and care facilities, there are many in our community. These are also, again, considered assisted living. These are single-family private residential homes located in our own neighborhoods, which are licensed to provide care to a maximum of 6 people at one time. It's in a more intimate environment. The atmosphere is more conducive to people who are looking for a smaller home-like atmosphere in which to receive care, depending on what that individual needs. But they do follow the same policies and guidelines as large assisted living facilities do. Skilled nursing facilities, these are also called nursing homes. These are 24-hour medical care facilities with nurses round the clock, as well as a physician medical director on staff. Many of the individuals in these types of facilities are there recovering from an illness or an injury, receiving rehabilitative care, and hoping to return back home. There are also long-term residents in skilled nursing facilities as well. I do want to touch on dementia care. Folks who are diagnosed with Alzheimer's disease or another type of dementia. Many times it is thought that folks with this type of need are more appropriate in a skilled nursing facility or a nursing home, but actually people with these types of this special need it's more appropriate in the assisted living environment. Commonly, memory impairment care is given in an assisted living community in a separate area of that community that is secure, has specially trained staff with specialized meal plans and activities, and a safe environment for people with these special needs, or of course in the small board and care facilities. Multi-level care facilities, there are not many of these in Ventura County. One might be considered University Village, Thousand Oaks, up by Cal Lutheran University, brand new. But a multi-level care facility provides all levels of care under one roof in one location, from independent living quarters to assisted living, skilled nursing, and then the memory impairment care. Regulation for each one of these different levels of care is different. Independent facilities for seniors, independent housing, of course, is not regulated and does not answer to a regulatory body. Assisted living facilities and the board and care facilities, they're regulated by the State of California Department of Social Services Community Care Licensing Division. Skilled nursing facilities or nursing homes are licensed by the Department of Public Health. So all of these facilities are on public record, which is important to know. Payment methods also vary depending on the level of care or which type of facility. Independent living, or more commonly assisted living, is private pay. Medicare and Medi-Cal pay no part of assisted living services. This is not commonly known and very important to make note of. Assisted living care is it's on a month-to-month basis. It's like paying rent for a regular apartment. The only thing that might cover assisted living is if you have a long-term care insurance policy which provides assisted living care services specifically in it. So you want to take a look at that policy. Skilled nursing facilities, of course, Medicare, Medi-Cal, those entitlements, and private insurance pay for skilled nursing facilities, but again, not assisted living. I think it's really important, any family that is going through the process of choosing whichever care facility it is, has advocacy and consults with professionals before the decision is made so they know the questions to ask. This is not easily done in a crisis, so we always encourage people to take a little bit of time ahead of time if possible. Some of the professionals here today are great people to consult with if you want to know about care facilities in the area, senior concerns. We've all talked about the advocates over there. Another great group of people to consult with. You can also go to the regulatory bodies of these facilities and ask questions about the facilities. Ventura County is extremely lucky to have the Ombudsman program. It's wonderful. You can call them for information on facilities as well. They will be your advocate. Medicare just recently came out with a new tool called Nursing Home Compare. If you go on Medicare.gov, you can click on the Nursing Home Compare tool and instantly see reports for our local skilled nursing facilities. As far as assisted living facilities, you can contact that regulatory body or get information over the telephone. But I do think it's very crucial to consult with someone. That ends my presentation. Do we have questions now?
Yeah, please, Jim. I see, but with your background and credentials, you certainly have an understanding of the senior situation. But sort of almost like I said before, do you have to have any credentials to be able to discern some of the different afflictions that may affect a senior? And are you legally liable if you do not send the person to the correct facility?
We are not. California Senior Living is a referral service. So what we do is we actually physically go into the care facilities, evaluate the facilities, and gather that information. When an individual calls our service, we basically do an assessment of what their needs are. And remember, most of this is non-medical. Sometimes it touches medical care, but depending on their diagnosis or what their day-to-day needs are, we're qualified to know which type of facility fit that criteria. Now, as far as which facilities we would refer, not really recommend. The family has to be very active in this search. It needs to be their decision. But we'll give them the tools to use to make the right decision, the questions to ask, and most importantly, we always follow up after their loved one has moved in to make sure they're satisfied and they're getting what they were promised. I hope that answers that question. Yeah.
Is there a phone number that you might want to give?
Yes, I appreciate that. You can call our office anytime at 805-371-8080, or you can visit us online, californiaseniorliving.com, and see information. And really, again, it's a process. We provide a valuable service. I believe families need information and advocacy through this process, and we provide that. Thank you.
Thank you very much. Our final speaker will be Kimberly Jackson, who will talk about Vistas Hospice.
Thank you. I'm Kim Jackson. I'm with VITAS Hospice. We get it all different ways, but it's actually VITAS. And I'm here to talk about the hospice benefit. Medicare has a hospice benefit covered at 100% with no deductibles or copays. Medi-Cal does as well, and all of the Medicare-managed HMOs fall under the Medicare guidelines for hospice. Hospice is a service provided for people with terminal diagnoses and have a prognosis of 6 months or less that either opt out of treatments or there are no aggressive treatments available for them. So the focus of hospice at that point is quality of life and comfort care. And that's done with a team of people. There's a physician heading that team, a hospice physician that is trained in end-of-life care and comfort. We have an RN case manager, and that RN will visit a person on hospice anywhere from once a week to once a day, depending on what's going on with them and their symptoms and their needs. There's a home health aide that can provide personal care. It's a certified home health aide. They have to be licensed, certified. And they will visit 2 to 3 times a week for personal care and bathing. And there's a social worker on that team for emotional support, community financial resources. They make an assessment of every individual being admitted to hospice and determine those needs at that point, as well as a chaplain, a non-denominational chaplain that is there for spiritual support. So that team is helping a person on hospice and their family with an overall picture. It's not just the medical, but it's the psychosocial and spiritual needs of not only the patient, but the family as well. Hospice, this program that's covered by insurances, also supplies durable medical equipment. So any medical equipment that's needed, hospital beds, overbed tables, wheelchairs, walkers, whatever it is that's assessed, is provided under that benefit, as well as any medications that are related to that person's diagnosis or any comfort medications that's needed to treat their symptoms. That is all part of that hospice program, as well as a bereavement follow-up program for the family for 12 to 15 months after a person has passed away. So that is a generalized hospice benefit covered by Medicare, Medi-Cal. Medicare managed HMOs, that falls under Medicare as well. Private insurances for people 64 and younger also have hospice programs, but they usually will have deductibles and co-pays with that. So, to qualify for hospice, 2 physicians need to say that somebody has a prognosis of 6 months or less. That is their attending physician, their physician that has been seeing them, as well as the hospice physician to certify that. When that happens, a nurse will come out and assess and set all of these things up. Hospice can be provided anywhere that the person is. They can be at home and have care at home. They can be in an assisted living facility, in a board and care. They can be in a skilled nursing facility, and they can also be in what we call an inpatient unit for people who have a higher level of care, maybe a symptom out of control that they need to be seen every day to bring that symptom under control. An inpatient unit is usually in or associated with a hospital. Not the acute portion of the hospital, but maybe a transitional care unit associated with a hospital. So that care can be provided in a hospital setting. There's also another benefit provided by Medicare. It's called continuous care. It's for those people who meet that criteria but want to be at home. But they have a need that's a little more than just your routine people coming out. We need to be there every day to bring a symptom under control or work on comfort. Continuous care is a program where there's LVNs and home health aides that will come to the home 8 to 24 hours a day, hospice-trained staff, and will stay there in shift care until that symptom is resolved. It's a very strict criteria by Medicare as well as inpatient. That's a strict criteria also. And so it is reevaluated every day, and it could be anywhere from 2 days to 2 weeks long, depending on what's going on, but that benefit is there. There's also respite care for people who are caring for their loved ones at home and need a break. Hospice pays for a 5-day stay at a skilled nursing facility to give those caregivers a break. There's no limit to the amount of time on hospice. You do have to qualify for certification periods. Once you're signed on to hospice, that's 90 days that they're saying that you qualify for. And then it's 60 days thereafter. But as long as you qualify, people have been on hospice for a year, sometimes 2 years, depending on their condition, because the prognosis is based on if the disease runs its natural course. Well, we can't control diseases and how they're going to run, so. People can continue to see their physicians for unrelated symptoms or unrelated diagnoses. So if somebody were, say, on hospice for cancer, but had a heart condition, they can continue to see their cardiologist, and their insurance will continue to pay for that. I think I covered that benefit. Does anybody have any questions?
Yeah, I've got one.
Okay.
I know you work in conjunction with other hospice caregivers and respite givers. You mentioned respite, but your respite, as I understood your definition, was the person goes into a facility for a few days to give. So you don't provide the day-to-day respite care if wife needs to go shopping or something
There is
like
a volunteer program, And so volunteers, I'm sorry I missed that. So the volunteers do go out and can stay with their loved ones while they go on shopping trips.
Now,
But these are overnight stays. Respite Care is actual 5 days, up to 5 days, overnight stays. They have to be in a licensed skilled nursing facility for Medicare to pay for that benefit. Yeah.
Are you familiar with the vigil program that Hospice of the Conejo is doing, which is the point of death, someone there for someone who has nobody? Are you familiar with that program at all?
No, I'm not familiar with that.
It's a fairly active program, fairly new. It's something that's going on across the country for people who have no one, or a group of people who will be on call at a hospital or someone's home to be with the person at the actual moment of death.
That's great. I'm aware of that program at Los Robles specifically, but I wasn't aware that they actually have the
Hospice of
homes
the Conejo
as well.
is running in conjunction with Los Robles is doing that. So.
Yes. Great.
Leo.
On behalf of anybody who has used hospice, and to you specifically, and for our viewing audience, thank you very much. I had the fortunate experience of having to do with a hospice team for a member of my family who passed on a couple of years ago, and that was absolutely outstanding. You said something that troubled me at the beginning of your presentation, where no potential or assertive care is available to the patient. And the reason why it troubles me is because in certain kinds of cancers, my personal experience has been that the attending physicians sometimes are unwilling to give up.
That's true.
Can you address that in a little bit more detail? How do we get them to give up?
It's, that's my constant battle, actually, is continuing education with the physicians. It's very difficult for not only physicians, but sometimes that medical society to say, let's put our focus somewhere else. Let's focus on comfort. Because we find that the medical model will go and go and go and go and go until somebody says, that's enough, let's stop. And unfortunately, most of the time, it's not the physician that says that. They don't want to be the one to say, let's think about stopping. So we continually educate the community, the physicians, to try and have those hard conversations with families.
For those situations, many people, and more probably should get it, have what they call a health directive, or there's a legal term that either a member of the family or the individual can be assigned to a person in the family that says, if my family determines that it's time, pardon the expression, pull the plug, then basically legally that's the way it's done. Now, I think that's done. I know many people do not have it, but it seems to me that's probably an area that needs to be re-educated.
Absolutely. The advance directive, everybody needs an advance directive. It really is, it's for the medical community, but it's really valuable to the family because they are upholding the wishes that were already made. And so that family needs to be the advocate to say, this is what my loved one wanted, this is what they wrote down, this is where we need to go. Unfortunately, sometimes even the advance directive is not followed in some cases if the family is not willing to be an advocate. So they have to step up and they have to say, this is how I want it done, sometimes in order for it to be done.
I ran into the exact same situation with my mother. She had an advance directive. But the doctor, a relatively new doctor who was full of zeal and enthusiasm, wanted very much to continue a fairly useless treatment. and was unwilling to give up. And we had to kick and scream about that. And my mother wanted that to happen. We wanted that to happen. But just the presence of the advance directive does not necessarily change the doctor's diagnosis.
Absolutely.
Yes,
one thing that the audience might find helpful is that if you do not yet have an advance directive, there is a new type, perhaps more user-friendly type of advance directive that is recognized in the state of California, and it's called 5 Wishes. And for those of you who are internet savvy, you can Google that and come up. I don't have the website for it right now, but what this pamphlet does, Carol Freeman is motioning to me that she has those pamphlets at Senior Concerns, and that pamphlet has legal effect when it is signed appropriately, and it walks both the family and the person through a discussion about what your wishes would actually be. The advance directive document, as it is designed, is for those of you who have used it or have one, is a kind of a cold. It doesn't address all of the nuances of the end of life. And I think that you would find this particular, thanks. Francine just handed me the correct website, which is www.5wishes.org. And aren't laptops wonderful, Francine? But it is a very useful tool for people to use. Again, if families want to understand more, and families really do need to be advocates, there is also a product that they can purchase, and it might be available in other places in the Caneo, and it's actually a card game, and it's called Go Wish. And it is a deck of cards. Actually, when you purchase it, you receive 2 decks of cards, and they're 2 different colors. They're the same deck, but different colors. And you sit with the person, maybe it's your spouse, maybe it's a parent, maybe it's a friend for whom you are advocating, and you then play this game of cards. And the card game is simply that you put in order the 10 things that are most important to you, and the person whom you're speaking with puts in order the 10 things they think are most important to you. And then that way dialogue can begin, and you can really begin to understand what the other person's wishes are. It is so very important, as you said, that people talk about this ahead of time. At the end of life is not the time to be trying to have that discussion. So thank you very much.
Thank you. Any other questions? Okay.
Thank you very, very much.
Thank you.
Thank all of you. It was a very informative meeting, and thank you for your time and attention. We appreciate it very much. All right, we'll move on to the other parts of our meeting, and that would be our committee reports. And our first report is Commissioner Poprock, Healthcare.
TOTV, would you please put on the PowerPoint? What I have to present today is a new law effective January 1st in the state of California. It's Assembly Bill 3000, and it's called POLST. It is the Physician Orders for Life-Sustaining Treatment. And I thought it certainly dovetails with our hospice presentation that we just had. And what it does is that it establishes the legal equivalent of a pre-hospital do not resuscitate order. And it requires healthcare providers to honor it. It's endorsed and supported by here in California, it was originally endorsed and supported and still is by the California Coalition for Compassionate Care. And it was originally intended to be for those people with a life estimate of 1 year or less. What it does is it affirms your wishes for care in an emergency or at the end of life, and it does it in a legal way. Advance directives are wonderful, and every one of us should have them, but they are not a they're not a legal document that is always available exactly at the time of an emergency. So take a look at this. I will give you the website at the end of this. Post law does not mandate that a physician use it, but one of the requirements of it is that they must honor it if it is presented to them by another patient or physician. It requires a physician's signature as well as the patient's signature, and what it becomes essentially then is a doctor's order. So even though it doesn't replace the advance directive, it can be more readily available, and it is a physician's order and has the authority of law. Again, all of these things require conversation, and the conversation in this case needs to take place with your physician. It is a signed medical order, and it addresses a range of life-sustaining interventions, but in a very understandable way, much in the same way as the 5 wishes document that I mentioned to you before. It allows for choosing a treatment or for foregoing that treatment. It is brightly colored. The hot pink is not because I am, how did Susan Cashman put it, of a female certain age, but it is the color of the document, actually. It is a hot pink so that it can be a sizzling senior. Thank you, Susan. So it's brightly colored, clearly identifiable, and it's a standardized form. It's recognized and honored across all treatment settings, again, by law as of January 1st, so that, for example, if you are at home and have to be transported to an emergency room, you can bring it with you, and it must be honored by the emergency room physician, whether or not that physician has access to your advance directive. And then when you leave the hospital and go back home again, it goes with you again. It might be, you might want to revise it at that point, or if you go from the hospital to another care facility for rehab, for example, or if you're receiving home health, it will be honored by all of those places, as well as by the emergency medical service system. It was started in 2007 in a trial. Ventura County is one of the local communities that has been working with the California Coalition for Compassionate Care. On your screen you see the other communities that have this in place now. This is a nationwide initiative and is also available in many states that also recognize it in law in those states. And if you would like to find out more about it or to get a copy of the actual document, you can go to www.finalchoices.calhealth.org.
Thank you very much, Susan. Are we moving on to legislation? Commissioner Frothingham, you have a report?
Yes, I'd like to briefly describe 2 pieces of legislation that were introduced in the state of California in the session that just ended, and these affect the senior population in California's state prisons. And as background for this material, if I could have the first slide, TOTV. We now have over 10,000 inmates in California prisons who are over 55 years of age. This number is expected to grow to in excess of 30,000 by 2022, and we just earlier heard Maureen Simons estimate that the growth over the similar period of time in her business is expected to double. So this tripling and so forth is in excess of what we might expect outside of the prison system. This growth is not because seniors have a greater propensity for crime than other citizens, as you might expect. There are a couple of factors that have contributed to this, one of which is California's three strikes law, which increases the number of people who are serving life terms in the prison system. And a second contributing factor is Proposition 9, which voters just passed in the last election and so forth, which would reduce access to parole by extending the time interval between parole hearings to 15 years. The annual cost of maintaining a senior in the prison system is now approximately $138,000. If I could have the next slide, please. We can compare this to other factors. This is 3 times the cost of maintaining a younger prisoner in the same system. And it's also 3 times the entry-level salary of a California school teacher. So in a sense, the prison system is competing with the educational system for state funding in a real way. We also recognize that recidivism among senior parolees is less than 10%, and this compares to 70% for others, although they're not paroled at a higher rate in recognition of this. Can I have the next slide, please? The last 2 governors, Governor Schwarzenegger and Gray Davis before him and so forth, have routinely denied parole board recommendations favoring paroles, and this has tended to keep seniors in prison longer than they might otherwise have, according to the wishes of parole boards. Some factors that are taken into account in these bills that were introduced into the legislature are that all prisoners are expected to do the same work, regardless of age, and so senior prisoners are not given any privilege and so forth as far as work assignments are concerned. The same thing applies to their assignment into bunks within their cells and so forth. Senior prisoners are just as likely as junior prisoners to be assigned to the top bunk, where they may have less or more difficulty getting into that bunk. They're also not given any preferential treatment when it comes to how close their cells are to where they eat or where they have to work and so forth, so many of them have long walks. The first of the 2 bills that I'd like to mention is Senate Bill 1555, which is called the Protection of Elderly Prisoners Bill. And among the features of this bill is it would establish an elder work policy that would ensure a safe working environment for older prisoners, and this would address the issue that I just raised about all prisoners being assigned to the same type of work regardless of age. It also provides staff training on the unique requirements of older prisoners to ensure that staff are recognized when a senior prisoner may be having difficulty in doing a particular type of work or getting to meals or work detail. It would also create an elder ID card that would give senior prisoners priority access to dining halls and medication lines. Next slide, please. It would provide pre-release planning for senior prisoners so that senior prisoners that get out into a world that's very different than the one that they experienced when they entered the prison system and so forth, where their medical benefits and so forth might be provided by Medicare. It would help them plan for that environment and file what forms may need to be filed. It would create an elder helper position that would work within the existing work programs that would assist seniors with their daily living activities. The second bill is an Assembly Bill 1965, which addresses early release for senior prisoners. And this would provide summary parole for prisoners who meet the following requirements. They have to be at least 55 years old. They have to be incarcerated for a nonviolent offense. They must have served at least 50% of their sentence. They must be diagnosed with a chronic illness or disease that requires ongoing medical attention, and they must have medical coverage that would cover this illness or disease. And that's the end of this presentation. Any questions?
Anybody? Wow. All right, our next committee report will be on fraud. Martin?
Well, last month the Madoff Fraud hit the news. And it was a typical Ponzi scheme, and we had touched on this type of fraud in the past, but never in real detail. So the time has probably come to go into some details to what it is and how you can become a victim, because if some of our smartest and wealthiest people and major international banks, they can fall for it, well, so can you. The Ponzi scheme was invented by Charles Ponzi, born 1882, died in 1949, but the scheme that he invented in the early 1900s still lives on, so it'll probably never die. It's sometimes called a pyramid scheme because it starts with a few investors at the top, and then later on the bottom of the pyramid fills in with lots of investors. And the money they get from the later investors is used to pay the ones at the top. It depends on the continuing growth of the pyramid, but when it stops growing, the whole thing collapses. Now, none of us are going to be involved in anything like the billion-dollar Madoff fraud. That was so skillfully run that it ran on for many years. But we can be cheated out of our savings by conmen who prey on us. And here's how it works at our level. Usually the conman will join a club, or a gym, or church, synagogue, or temple, and just try to make friends. He will offer someone an investment opportunity that promises an interest rate much higher than the one that he could get from his bank or from a CD or a mutual fund. For example, if a safe investment at your bank is paying maybe 2 or 3%, he'll offer you 10 or 12%. So the victim will give him $10,000, and he will pay him the conman will pay him $100 every month, which is a nice 12% annual rate. After a few months, the victim is so happy to keep getting these $100 every month that when the conman comes to him and says, you know, we'll have an opportunity to increase your investment, well, he'll give him more money, and he'll recommend this man to all his friends, who will also start giving him money. Well, the money from those later investors are used to pay the older investors. Now, when there are no more new investors, the conman will leave with whatever money is collected. Remember, he never really invests this money. He's only using your money and those other people's money to pay this so-called interest. The scheme depends on recommendations from friends, and is aimed at financially savvy people. So just because you're a wise investor with lots of money in the stock market and all that, don't think you're immune, because you have money and understand these things. The con men are very smooth operators and have fooled millionaires and very professional financial planners. So carefully check out every investment offer with someone you trust and who is not involved in it. If you don't know who to call, there's an organization called SAFE, S-A-I-F, which stands for Seniors Against Investment Fraud. It's part of the California Department of Corporations, and their phone number is 866-275-2677. Remember the old saying, if it's too good to be true, it probably isn't.
Thank you. You can also check, I believe, with the city attorney or the county attorney, the district attorney. Don't they have a staff that looks at schemes and frauds and things like that? You can get a recommendation as to whether or not.
The DA has an organization called Adult Protective Services, and they could provide some help.
Okay.
They, by the way, are in our
yes, they are.
our senior directory.
Okay. Any comments or questions about that? All right, let's move on to disaster and emergency preparedness. Leonard?
Thanks very much, Jim. The thought occurs to me that this has turned out to be a kind of a gloomy meeting, so here's your comic relief coming right up. Turns out that big in the news the last several months have been stories about something called Reverse 911. And when I told my wife last night I was going to talk about Reverse 911 today, she said, "Oh, that means that somebody's going to dial 119?" And I said, No, that's not what we're talking about. Reverse 911 refers to a system of notification by, in this case, city authorities to the population of a city about emergencies that have happened or might happen in the city. It has turned out to be an extremely valuable tool, so valuable that now there are companies nationwide that will provide this tool for a price to cities. A good example, a couple of months ago, a tornado was impending in the Middle West, and the city was able to call every phone registered in the city to give the warning to the people that there was a tornado coming. In consequence, that city, although it was severely damaged, had no loss of life. That's pretty impressive. And you may have caught the fact that in the recent spate of fires we had, particularly the last of them, the citizenry was notified well enough ahead of time so that they could evacuate if they felt that they wanted to do that. And in consequence, firefighting was made easier, and I believe I'm correct, I do not think we had any loss of life at all during that spate of fires. That's pretty impressive. Well, Thousand Oaks has just begun its own system, and I really want to urge everyone to sign up for it. We need to opt into the system. Now, some of you may remember a very popular TV show from a long time past. There were new visuals used on that TV show, which was hosted by, of all people, a bishop in the Catholic Church, a fellow by the name of Fulton J. Sheen. And he called his visual operators angels. Well, here in City Hall, we have, in this meeting room, two angels. One is the TOTV angel, and the other one is Miss Francine Spriggle, who is much too young to remember Fulton Sheen. But at this particular point in time, Angel Francine, may I have your computer screen? TOTV? And what we're going to do is we're going to go to the city site. Now, she was thinking ahead for me, darn it, and I wanted you all to see the blue screen of death that comes up before the city site winds up, but that's okay. Some of us who are computer users won't like that. But it does look like the blue screen of death, all due respect to the website master. On the city website, there is something called Spotlight, and you'll find Spotlight in the lower left-hand corner, and there it is. And down at the bottom of that blurb is a blue line that says, click here. Ignore the writing that's there. For one thing, it won't help you at all, but the panel will that's going to come up next. This is the self-registration page for opting into the city's emergency notification system. And by the way, she went to it quickly and adeptly, but I want to remind us that we have a terribly complicated website name, www.toaks.org. Don't type the O twice. It's not T-O-O, but toaks.org. Okay. You now have a self-registration page, and self-registration is very easy. To type your name in the blocks, and you need to give an address. And once you've done that, and you see the little red asterisks that are on the screen, you need to fill in that kind of information, and then the city can do the rest for you. Now, what's really interesting about this program that the city has is that you can be notified in more than one way. So anyone who is out there in TV land and needs to have some sort of special notification by fax or by any one of those devices for people that have some kind of sensory disability, then your needs can be taken care of. My wife who operates out of her cell phone is an absolutely excellent candidate for putting her cell phone number in there. Since I'm operating mostly out of our home landline, I'm a great candidate for having that in there as the home phone. I urge you to opt into this system. The fine print that I asked you to pass over reminds us that the city and the company the city is contracting with have exercised all due care and consideration so that we won't get spam on our telephones. That would be a bad thing. I finally have got to the point where my telephone, thanks be, doesn't ring at all, kind of unless I want it to during the day. And I guarantee you that as nearly as I can tell, the city and the company will not spam us with unnecessary telephone calls. What's really interesting about this system to me is the capability of it by just using a little circle that can be drawn on a screen by a city manager. They can simply draw a screen on a map of the city, and everybody within that circle then is notified that, I don't know, a herd of elephants is coming down, stay in your house, or something of that nature. It's a great system. I'm sure that there are going to be other ways for us to use it, and we're going to want to tell you more about that in forthcoming meetings. Now, if I may have the camera on me, TOTV, please. In your utility mailings, you should receive a pamphlet like this that gives you the same kind of details that you saw on the screen. And to be doubly sure that everybody has a shot at this, if you are not computer illiterate or do not have a computer handy to you, in the meantime, you can call 449-2743. And the person answering that phone is quite likely to be Angel Francine, and you will get from her either a form or information over the phone that will help you. And we're working now a little bit on getting an outreach, perhaps at Goebbels, so that if you would like to, you could sit at the computer and we'll show you how you can enroll yourself. One other quick point, and this happened and it's not a part of this. 2 nights ago, quite a lot after dark, 8 o'clock as a matter of fact, the doorbell rang and a person was there soliciting to clean my carpets. Now this was at 8 o'clock at night. Do not, I say again, do not, under any circumstance, open your doors to any person like that. Now, I had my trusty sidearm, which in this case was a very noisy golden retriever, and another trusty sidearm, which is a very large and surly-looking bearded collie, both of them barking at 150 decibels, which is well beyond the pain level in hearing. But everyone in the audience, please, our natural tendency is to help people out. Do not open the door. If they need to have a phone call made, take the number and make the call yourself from inside. And I need to tell you that because I didn't think it would happen in our fair city, but it happened to me the other night, and I want to let you know. Thank you, both TOTV Angels and Francine Angel. Jim?
Thanks very much, Leo. If you can just loosen up a little bit. Wait.
Question for Leo.
Question.
Yeah, what is the relationship now between that system and the emergency system that you get on on television and on the radio with the beeping? It seems to me at some point they would merge.
Mel, I don't know that. We're still, Francine and I and Graham are working on on how all of this goes together. Some of you may remember the 94 encounter with Mother Earth that we had even here in TO. My lights were out for 12 hours, and so therefore it was very, very difficult for me to get any information from any place. And I believe that the city is now attempting to be sure. And Graham Watt's statement is that this is one of the many advices that we're going to have for the city.
What would be a typical response? Say you were on this program and the phone rang and you picked it up. Would they describe the emergency? Would they give you suggestions as what to do? Is it a recorded thing? Or is there a human being talking to you?
Let's see, which of those questions do I want to get in trouble with first? The easiest one. It's a recorded message that will go out letting you know what the emergency is, and then letting you know what to expect, what to do. And the simplest example of that would be the fire has now approached a critical stage for the northeastern sector of the city. Everybody in the area bounded by so-and-so and so-and-so should evacuate. But the wonderful thing about this system is that it allows other kinds of interties. And my active brain is saying, you know, for instance, why couldn't we notify caregivers? Why couldn't we let somebody in another state know that this is going on?
When you register on the website, you have the capability of entering a multiple amount of phone numbers. They can be in-state, out-of-state. The area code does not matter. And the system will rotate through all of those numbers until it reaches one or two or whatever is designated. So, yeah, you can add a caregiver to that.
Can you imagine how wonderful that idea is? Because I have children that live a long, long way away from here, and they have, if they see a statement on CNN that says a wildfire is threatening Thousand Oaks, well, they go into a state of panic. And if my daughter, which would be my intention in Virginia, were included on that list, she would get the notification, this is the area that has been asked to evacuate, and knowing that we're not included in that area would automatically let her know. I should think that would cut down the pressure on the telephone system for people trying to get in contact with their loved ones and to find out if they're okay or not.
And one distinction that I see between this and the TV advisories we see is the opportunity to be much more focused. I mean, they're asking for your address and even latitude and longitude. And, and the TV advisories that I see, you know, you're looking for what counties might be covered, and the county's the smallest unit that they seem to deal with those advisories. Here it can be what's happening in your backyard, and there are only 6 houses really that need to be notified. Everybody else doesn't really need to know.
As a matter of fact, Nick, that happened in a recent fire. A friend of mine lives high above Malibu in the hills, and he doesn't have a landline, so the Long Lat address would be absolutely perfect. It would let him know that, by golly, he is in danger, or if he doesn't hear his longitude, latitude come up, then he knows that it's okay. Don't worry about it right now.
I'd like to add something to that. If we have any type of a disaster that knocks out the electrical power, your cordless phones, your cell phones are inoperative. But if you have a regular landline of the telephone company, usually it's still powered. You can get information over that. So if you still keep one of the old phones wired into your system, you have some means of communication.
That's an absolutely excellent point. The one phone that worked in my house in '94 was the funny GE phone that everybody in their office had, and I've kept both of those phones, even though they don't get a dial tone.
Okay. All right. Let's move on to our liaison reports. RSVP. Arden, anything there?
Sure. Let's see. Well, in cooperation with the Internal Revenue Service, trained and certified RSVP volunteers will provide free income tax preparation for persons in either of these categories: a senior who is more than 60 years old, regardless of income. at any income level, or a person less than 60 years old with an income of less than $45,000. The program will start February the 4th, so at our next meeting I will reiterate this to remind everyone. This year they've added another location. Last year was only at the Global Senior Center, and this year they'll also be doing it at the Newbury Park Library. Wednesdays they'll be at the Newbury Park Library. Thursdays and Fridays they'll be at the Global Senior Center. They'll be running from 9 o'clock to 3:30 in the afternoon. It's a first-come, first-served system. There are no appointments taken. And next month I'll give you this long list of things you should bring with you when you go for this service.
It's an incredible service. Gene, do you have any recollection of the number of people that cycled through there last year?
Yes, as a matter of fact, at the Global Center currently, we're running at the rate of 14,000 individuals per month that come to the center.
No, I'm talking about the techs that utilize the tech service.
Yeah, there were more than 1,000 people, a little over 1,000 people, whose complete taxes were done and transmitted to the IRS.
Andrea Koval, who gives our Global Adult Senior Service update, is not with us today. Gene, do you have anything specifically that you'd like to mention regarding what's going on at Globals?
We offer bingo, as mentioned earlier.
Boy, do we ever.
Every Tuesday, Friday, and Saturday. Don't forget, get there at 12 o'clock and look out if you want to sit
don't get in the way. I actually got an opportunity to call bingo once, and actually came out of that alive. So, okay, commissioners' comments. Mr. Silverberg, you have something?
Yes, thank you, Jim. My brief report is neither funny nor sad, but it is very sobering. The Department of Housing and Urban Development, U.S. Department, every 2 years in every city conducts a count of the homeless population. And the reason for that, the reason for that is that so that they can determine the level of funding that may be needed for various programs related to the homeless. There will be the homeless count this year will be on January 27th for the city of Thousand Oaks, and it is being coordinated through Many Mansions, a nonprofit organization, and Many Mansions will be conducting volunteer training sessions. Now, let me just say that from my own personal experience, the seniors can get involved, can participate, and their help will be very valuable. It is senior friendly, it's safe, and the training provides that. There are a number of hours of sessions that you can go to. Obviously, there's one from 5 to 8 in the morning, and I suspect that's not the best time for a senior, although many do get up at that hour. But I think seniors would prefer to work the daylight hours, and that's like from 9 to 12 and 12 to 3. It is a very, very rewarding experience. A group from my group at B'nai B'rith had 7 members last year. Not all could walk well, but nevertheless they could do that, and they went to assigned areas. It is a very, very rewarding experience. There will be 2 training sessions, and one on January 14th and January 19th. For details, to sign up or what have you, just call 496-4948, extension 244, and contact Lindsay Garna of Many Mansions. We normally don't think, because most of us are fortunate, we normally don't think of less fortunate seniors, but the homeless count, in fact, does show a senior population, and I wouldn't be a bit surprised if that count will increase during this current period. So anyway, thank you very much, and we can use your help.
Thanks, Mel. Harry?
Yes, thank you, Jim. I'd like to say that I hope the people out there are listening, because we are going to present two very important programs in the near future. I haven't got the date set up, but one of them will feature Dr. Bresky on line exercises, and another will be a forum on affordable housing. So just watch for the announcements, and they should be out very soon. Thank you.
Thanks, Harry. Well, I have a question, and the question is this. Oh, I'm sorry. Go ahead, Gene.
Yeah, I didn't want to let us go off the air while we had a listening audience without mentioning the Senior Adult Master Plan. It wasn't on our agenda for today.
That's what I was going to talk about.
Oh, I see. I'm sorry. I was just going to mention one piece of that, and that is the community meetings that are coming up.
Well, why don't you go ahead and mention that? Here are the dates. That's what I was going to mention.
Oh, okay.
Since we're into it. Yes, that's extremely important.
Okay, we have a beautiful brochure here that we'll be sending around to everybody. If you are a baby boomer, that is, if you were born between 1946 and 64, you would be considered a baby boomer. After the age of, after that, you're considered a senior. If you're born someplace in the middle, I guess you have a choice. We're going to have two meetings with the community, and
what's the purpose of the meeting?
Yes, that's what I'm getting to. The Senior Adult Master Plan, as the group here at the Council on Aging and also the advisory group, have been working now over a period of almost a year on the Senior Adult Master Plan. And the time has come now to go to the community to get their input, and we wanted to extend an invitation to all seniors and baby boomers. We'll have two separate meetings. The baby boomer meeting will be on February the 19th, and that will be from 6 to 8 p.m. And please come. It's right here at the Civic Center at the Copley Theater. And we want very much to get your ideas, your concerns, and your recommendations about our community and the growth in our community that we can expect. Part of what we heard tonight about the number of seniors and the growth of the senior population. And what should we do about it? We need your help, and we need to get your input. A second meeting is a meeting of seniors, your birth date before 1945, and that will be at the Global Senior Adult Center. Those of you who do not know where that's located, it's on Jans Road, right at the 23 freeway. It's on the same grounds as the library, and that will be on February the 23rd from 10 in the morning till 12:30, and lunch will be served. Please join us to discuss planning for the future needs of our community for our senior population.
On the, maybe you did and I just didn't hear it. On the baby boomer meeting,
yes.
Is there lunch or is that something else?
Yeah, I guess I didn't mention that we're going to offer wine and cheese.
Yeah. All right, thank you, Gene. All right, I have just one more little thing to say, and that's that I would want to encourage all of you lovely ladies out there to go ahead and be a contestant in this Miss Senior California. You're going to have a great time, meet some terrific people. So if you're at all interested, please call this number, area code 818-883-8975, and talk to Susan Cashman. You're going to have a great time. Thank you. Is there any other business before this council? If not, we are adjourned.